Right. Well, thank you very much. I'm very pleased to be able to talk to you on this subject. I welcome the invitation from the Swedish ME Association. I should introduce myself. I'm a paediatrician from the northeast of England. I've been working in ME for the last 30 years. It's bad enough having a child with ME without having the professionals who should be looking after you actually persecuting the family. And I've got a rather bitter experience of quite a lot of cases like this, and I believe other countries have the same problems. Why are young people with ME and their families still being persecuted by caring professionals? It's an international problem. It's certainly a European problem. I have seen over 200 families in the UK subject to child protection proceedings. Although the title of my talk is about children actually removed, there are a large number of children who are pressured and subjected to hospital admissions who aren't permanently removed. And I've got clear evidence that there's similar cases in Sweden, Holland, Norway, Germany, France, Denmark, and you will have read about some cases in the USA. It's possible that this problem is becoming more frequent. At the end, I'll mention a couple of developments in Britain which are leading to possibly it becoming more frequent. And there's a whole series of long COVID cases in children who are beginning to be at risk of being treated similarly. How I'm going to go about this is I'm going to give you some particularly bad examples and go through each of them in detail, and then try to understand where the failings were in the professionals. As you'll see, I'll put a lot of responsibility on the medical profession, but social services and education also contribute to this problem. My first case is an extremely tragic and severe case who was under my care 20 years ago. She was severely affected at the age of 15, lying in a very darkened room, bedridden, and a lady paediatrician subjected her to disbelief and said that she went to court to get a court order, and she told one of the highest judges in the land that if she was given this court order and admitted this girl to hospital for graded exercise treatment, she would have her back at school within 6 months. So she got a court order for 6 months. She was admitted to hospital and subjected to vigorous daily physiotherapy, and she got even worse. After 3 months, the girl bravely spoke up for herself, told the physiotherapist she was behaving unethically, and the physiotherapy stopped. The judge was then left without not knowing what to do or to admit that she'd been misled. And bizarrely, the family eventually persuaded the judge to let the child come to my care in Durham. And this is how she looked 20 years ago on my ward, catheterized in a darkened room and very, very severely affected. Her mother, who was a nurse, stayed with her at all times. Over the next 20 years, she remained severe, not surprisingly, and this is now a very current issue in that she has spent the last 18 months in hospital. She is fed with a nasojejunal tube, lies on a ripple bed, and still has a urinary catheter. And the hospital have lost patience with her and have virtually sent her home to die. There's an international petition up in her favour, which I'm asking the organisers of this conference to circulate to you, and I hope you will all sign it. So that is a very current case. I believe that girl was permanently damaged by the physiotherapy she was given. Slightly different case, but quite a famous one. This is well known in the public knowledge about this case, and I have met this boy. And this boy was diagnosed in the Isle of Man and was sent to London for confirmation of diagnosis. A trainee psychiatrist, who shall be nameless, intervened in the case and disputed the diagnosis of ME and said that it was all due to an overprotective mother. He persuaded the social workers in the Isle of Man to take the boy into care and to hospitalise him. Because the boy was not protected by a diagnosis of ME, he was then subjected to quite inhumane treatment in the hospital. The nurses would put him in a wheelchair without a seatbelt and push him around the ward at speed and then stop suddenly. And a normal child would be able to prevent themselves from falling. Unfortunately, the boy was unable to prevent himself from falling and frequently fell onto the ground. The nurses didn't learn from this and carried on doing it. They even took him to a kind of ghost train in a fun fair, and where he was assailed by skeletons and ghosts coming onto him, and they hoped to prove that he would put his hands up to protect himself, and he wasn't capable of that either. Finally, in a bizarre repeat of the medieval test for witchcraft, to prove that he was a fake, they threw him into the hydrotherapy pool to prove that he could swim. He didn't swim, had to be rescued, and would have drowned otherwise. That all went on because he was not protected by a diagnosis from ME and was subjected to disbelief. There's a similarity to a lot of these cases. A lot of doctors can tolerate moderate ME and they just can believe in it. But what they have trouble with sometimes is when moderate ME becomes severe. And this girl in Scotland was accepted as ME by her consultant, but then got steadily worse. The paediatrician panicked and referred her to a child psychiatrist. And the child psychiatrist made a psychological diagnosis and took a court order, removed her from her parents, and put her on a psychiatric ward. I was called to see her, and I found this poor girl on a psychiatric ward, tube-fed, in severe pain, sheltering from light and noise. And every time the door closed, the tremor of the noise gave her a myoclonic jerk. The disbelieving child psychiatrist repeatedly refused to allow her to wear eye protectors and ear defenders and would physically tear them off the girl if she tried to wear them. We managed to get the court order reversed and she went to a gentle, quiet nursing home somewhere else and fortunately made a good recovery. Now here's one a bit closer to home. Again, quite recent case, which I've been involved in. And this boy developed ME in Norway when he was 12. He had a younger brother who didn't have ME. The extended family on the other side of the family, the parents were separated, didn't believe that he had ME and went to social services. Social services investigated the family and made a diagnosis of parental alienation syndrome and Munchausen syndrome by proxy, or fabricated illness by mother. They made this on the basis of a psychologist's report. At no stage did they have a doctor. 2 professors of pediatrics in Norway diagnosed him as having genuine ME, and the social services chose to ignore them. I cannot believe it, but this is all true. And as a result, he was removed with his younger brother from this mother. And he told me when I saw him last year how the police pulled him out of bed by his legs. He was put in foster home for 2 years and did not improve. The 2 paediatricians in Norway repeated their diagnosis to social services and were ignored. I gave an opinion. I visited him and diagnosed ME and wrote to social services, and it was ignored. And finally, and this is a good lesson for people in this situation, the boy helped to win his own freedom, by which time he was 15 years old. And he was so fed up with the social worker telling about his terrible mother and how he should be getting better that the boy refused to speak to the social worker again, and even barricaded his room and locked the door so social workers couldn't talk to him. Grudgingly, the social workers allowed him back to his mother, and they took a further year to allow his healthy younger brother back home. So those are social workers ignoring medical opinion, making a diagnosis of fabricated illness without a doctor supporting them. Only a pediatrician can make a diagnosis of fabricated and induced illness. I had probably one of the worst cases I've ever seen from Germany. And this was a girl with severe ME who got into the hands of a neurologist who believed that he could cure her with an activation regime. And the activation regime was rather similar to that the boy in the Isle of Man got. But every morning this girl was pulled out of bed, strapped into a wheelchair, had her head strapped to the back of the wheelchair because otherwise it would fall, and was pushed around the ward to stimulate her. She then had an hour of pedagogy and then an hour of psychology, and she got steadily worse. This is how she looked when I visited her. She was in severe pain. She was too weak to turn herself. She had to ring a bell for the nurses to turn her, and she was treated like this in this hospital for 18 months. I was able to give evidence to counter the management, and for once in my life was absolutely delighted to have a delightful lady judge who listened to my evidence, and there was no opposing evidence, and she restored the mother's parental rights and allowed her to go home, where she slowly improved. And that is her at home. I think you can tell a difference in the light in her eyes from how she was in hospital. And that was 6 months later. Sorry, I'm jumping a bit. There's another girl, I think I'll leave this to the end if I have time, with a lot of these similar features, but I'll move on now. So basically, why are doctors behaving this way? And I would have to say that in every case except the Norwegian case, it was the doctors who were at fault. Okay? And if the doctors get it right, then social workers shouldn't be able to do anything. And the most important thing, as the great Osler said, there are three principles in medicine: diagnosis, diagnosis, and diagnosis. And the most important thing is to make a positive diagnosis of ME in a firm, definite way. And this helps to protect the child from disbelief and everything else. But some doctors are too frightened to make the diagnosis. Some of them are too ignorant. Some of them disbelieve in it. There's definitely some who are too scared of it because they think it's a cowardice. And there's plenty where they get into a confrontation with the parents who keep asking for second opinions because they haven't got a diagnosis. So that something goes wrong in the early stages. I've already mentioned that if the person gets worse, they panic, but sometimes just failing to get better, doctors find that difficult to tolerate. One of the worst things is the doctor who believes that he's got a treatment. And this belief in what I call the therapeutic fallacy was very prevalent in the UK with the proponents of graded exercise therapy and cognitive behavioral therapy. And that was based on the belief that ME was not a genuine physical illness. It was just due to faulty illness beliefs and deconditioning. And therefore, they should respond to graded exercise and cognitive behavioral therapy. The behavioral therapy got rid of the faulty belief systems, and the graded exercise cured them. If it had been true, 100% of ME patients all over the world would have been cured. It wasn't true. It was a great heresy. And the good news from Britain is that our National Institute of Clinical Excellence has finally abolished approval for those two treatments and has thereby abolished the biopsychosocial hypothesis about deconditioning. But in Britain, things got better in that way, and now they're getting worse again. And I'll describe this, but it's the diagnosis of fabricated and induced illness and functional neurological disease. And I'll mention these separately. So things have got better and then have got worse again. And a whole lot of long COVID children are now being subjected to the disbelief that ME children have suffered. And then I recently did a consultation for a girl in Sweden where none of her physicians could believe the severity of her ME and felt there had to be psychiatric overlay. And it was simply because they hadn't seen such a case so severe before. So doctors can get it wrong for many different reasons. As you notice, I use the term ME all the time, and I've always found that the doctors who prefer the term chronic fatigue syndrome tend to be less protective, less believing. And I had a patient where the diagnosis went from chronic fatigue syndrome to chronic fatigue to unexplained fatigue, no organic cause found, and left the mother at risk of prosecution for her son's inability to go to school. So labels, ME is a much more powerful label for protecting people. Some doctors, often of these are GPs, we don't believe in ME in this practice. Recently, a GP rang a helpline and was worried that he had ME, and the helper asked him why he was so worried. He said, well, you don't realize in our practice, it's been a policy to always treat patients with ME with disbelief, ridicule, and neglect. And I daren't tell my partners that I've developed ME. That's rather sad, isn't it? People who've never seen a child with ME say that children don't get it. I recently had to write a letter for a charity in Germany because they couldn't find enough doctors in Germany who believe that children under the age of 12 get ME. I'm also helping a case in France because there isn't a pediatrician in France willing to diagnose a 9-year-old girl with ME. I think you all know that children can get ME really quite young. 7-year-old. I don't like labeling cases. I had that just last week in a case. As I've said, a label of ME is strongly protective and helps people to get support and services. And if you don't have a label, you're at risk of being persecuted. Don't like making diagnoses for which there aren't any treatments. Well, doctors should have got used to that for some time. We have quite a lot of things that are incurable. And the best is you can't have anything wrong with you as all your tests are normal. This was from a professor of pediatrics who's written a textbook on pediatrics in which chronic fatigue syndrome is put in the section of adolescent psychiatry. This 6-year-old said to the professor, maybe I've got a condition for which you haven't yet invented the right test. I think you'll agree that's game, set and match to the 6-year-old. So if we can get rid of the therapeutic fallacy, there's no form of treatment that justifies coercive approach, forcing management on patients. I've mentioned that graded exercise and CBT have been abolished in the UK, but all the proponents of it are making a comeback using different labels, and they use labels like activity management, but always with the aim to set targets and increase the exertion. So a diagnosis leads to support and protection. ME is a far stronger term in achieving this, and I would like the term chronic fatigue syndrome to be allowed to sink into the dustbin of history. Why do social workers possibly get it wrong? Well, obviously, if the doctors mislead them, that's not their fault. and it's the doctor's fault. But on the question of fabricated and induced illness, there's been such a surge in this in the UK that the Association of Social Workers have seen these developments with suspicion and are warning social workers not to accept doctors' diagnoses of FII uncritically. If you're a child protection social worker, someone who works in child abuse, you are actually trained to be doubtful about what parents tell you, because really abusive parents can be very, very plausible. So something about being a child protection worker makes you less willing to believe innocent parents. There has to be, I've seen social workers actually enjoying the sense of power that they get. A lot of child protection social workers don't have much power, and they're used to having to fight to protect genuinely abused children. But if they actually get an innocent family, they find it much easier to deal with. And I do think there's an element of social workers choosing to work with innocent families rather than the really abusive families who might slash their tires and set dogs on them. There's also, and I see this in doctors and social workers, a rather unpleasant self-righteousness where they tell the parents who they're persecuting, we don't enjoy upsetting you this way, but we really like to tell you that we have your child's best interests at heart. And it's almost like the Spanish Inquisition say, we don't like torturing you, but we'll do you a favor, because once you've confessed, it means you'll go to heaven when we've burnt you. And I do see this sort of people working in the caring professions can really be unpleasantly self-righteous. Since the pandemic, our government is very worried about non-attendance at school. And of course, there are a lot of kids with long COVID who can't get back to school, but there's a lot of pressure from government to maximise school attendance in the UK. And children who are unprotected by a diagnosis of ME will be at risk. Those who have ME, who can only attend school half-time, are accused of bringing down the attendance figures for that school, and this affects them in the government inspection regime. And if a doctor tells the school that there's nothing wrong with a child, then the teachers will become part of the machinery that pressures that child to go to school when he's not well enough. And I think if there's one lesson I would like to get from this, people in this difficult area of ME, social workers, doctors, teachers, everyone should be open-minded and realize that doctors aren't infallible, social workers aren't infallible, judges aren't infallible. And of course, quite often child psychiatrists and psychologists get involved. And if you refer someone to a psychiatrist, they'll assume that there is a psychiatric problem in advance. And even if it's not obvious, they'll say things like, give me long enough, let me dig deep enough, I'll find something. And if you're a psychiatrist who likes seeing things that he's already got a preconceived idea about, I remember the motto, if the only tool I have is a hammer, everything begins to look like a nail. The girl in the case in Germany had a guardian who was a family therapist, and instead of standing up for her and her wish to go home, she diagnosed a symbiotic relationship between the mother and the child and supported the neurologist who was looking after her. And of course, a lot of families are referred to child psychiatry with a child with ME, and they can't see the point. So they attend once or twice, and then they say, thanks, we don't really need to see you anymore. And this makes the child psychiatrists feel a bit unloved, and they sometimes refer straight to social services because they haven't cooperated with their discipline. I've mentioned the biopsychosocial heresy, and hopefully, at least in the UK, it's on its deathbed, although it's being reinvented for long COVID. I've mentioned doctors, social workers, and teachers initiating child protection proceedings, but sometimes it's from within the family. Ex-husbands and wives can be disbelieving of the ME of the child and can actually, as in the Norwegian case, initiate proceedings by reporting them to social services. The one thing that is almost universal in every case I've mentioned is that they regard the child as belonging to them and not entitled to think for themselves. And nearly all these children, as you can see from the ages, are old enough to have wishes and feelings of their own. Last week I went to a case conference and the social worker had actually failed to fill in the section in her report on the wishes and feelings of the young person, and the case conference kind of willfully ignored that section in the conference when they're supposed to address it. And a lot of the kids I've seen are very articulate and very good at speaking in their own defense. In Britain, we have a concept of Gillick competence, which is that it's a sliding scale whereby a child without any age cutoff can be deemed competent to agree to have his appendix out, or to be discharged from hospital, or to withhold informed consent for treatments inflicted on them. And so it doesn't mean up to the age of 16, you can do anything you like to a child. I'll mention Tiffany later if we have time. I had a lovely 10-year-old boy who was threatened with going into foster care because the machinery had clanked into action. And I asked him his 3 wishes. This is a nice way of finding children's wishes. And you pretend to be a fairy godmother. And this boy said, his first wish was, I wish there were better judges and social workers who would protect children who need protection and leave families like us in peace. Out of the mouths of babes and children does one hear truth. I had pleasure in putting in my report for court. I once saw a girl at a ME conference crying in a wheelchair, and I was worried what had upset her. And her mother said, no, don't, that's all right. Those are tears of joy. And the reason she was crying with joy is after 3 years of undiagnosed ME, she had heard a lecture from Dr. David Bell, the American physician, and had realized there was one doctor in the universe who understood what was wrong with her. And I've already mentioned how the Norwegian boy refusing to speak to his social worker and barricading his door actually helped to win his own freedom. Neurologists have now invented a new condition in our country called functional neurological disorder. This is very fashionable. It's got several different meanings, but the most upsetting one is that it's actually hysteria or conversion disorder, and all in the mind. And I've recently had a child with severe long COVID who was being threatened with foster care, 15-year-old, against her will, because she had function. The paediatrician said she had functional neurological disease and wasn't ill and should be getting better, and blamed the parents. I know the cases I've described are particularly severe. Fortunately, very few children end up being actually removed from their family, but this is a tip of an iceberg. A much larger number are bullied and coerced into cooperating with inappropriate regimes, or school attendance rates that are higher than is in the child's interests. And this situation leads to a large number of people who end up mistrusting their paediatricians because they can't get protected, and they retreat, and that some severe cases are in danger of not seeing a doctor for 3 years and lying at home. Just to cheer you up, not really relative to the subject under concern, this is one of my favorite patients who made a full recovery after severe ME for 2 years, lying in a darkened room in total body pain. And I think she's a very good advertisement for immunoglobulin. I gave immunoglobulin to my 6 most severe cases. They all made full recoveries. Just briefly, I'll tell you about Tiffany's story. This has got all the same ingredients as the other cases, just a bit more detailed. She developed severe onset of severe ME and had to be hospitalized. and she was in for 3 months. And in hospital, she was given graded activity. They had weekly meetings about her where they set targets for the next week. And the nurses were told to leave her to feed herself and put the food outside her reach to give her an incentive. And the mother gradually got more and more upset at this, so they limited mother's visiting. And the nurses said whenever the mother comes, Tiffany bursts into tears, which is purely natural. She got steadily worse. The mother was blamed for sabotaging the program. She was only allowed in the evenings. She still got worse. She eventually took her home against medical advice. The family doctor used to upset Tiffany and reduce her to tears, and then went back to social services. And the social services and police took Tiffany back to hospital under a court order, treating her like fabricated illness. And the mother was only allowed supervised access to her. And social worker actually said, if you cry when mum comes, we'll stop your mother visiting altogether. When I visited her, I was called in by the court-appointed guardian. I found a demoralized girl, tube-fed, very unhappy. And when I asked her 3 wishes, instead of raising her sights and saying, I'd like to go home, I'd like to get better, she said, if I'm only allowed 1 visit next week on my birthday, could my mother see me without a social worker sitting in with me? I said, I think you can have a better wish than that, Tiffany. And I eventually empowered her to call her independent social worker to instruct her to go back to court and to allow her to go home. Tiffany at that stage was resigned to going to foster care for 6 months. She made a gradual recovery and eventually went with a charity to 10 Downing Street to meet Tony Blair's wife at a charity gathering to tell her story. Right. These horror stories, but I hope that they've helped with your understanding, and that some of the things I've talked about will help you if you're in this similar situation in the future. Naturally, I'd be happy to discuss any of these issues during discussion.